So, hello, good evening, everyone. Today we have with us Dr. Mariam, and she is going to share with us her experience of FRCS Urology preparation and her journey of FRCS Urology. She again passed her FRCS Urology Section 1 in July this year and Section 2 in November. And she passed both the sections in first attempt. And currently, she is working as a fellowship in female urology at Ireland under the Royal College of Surgeons. So very congratulations, Dr. Mariam, and you have been celebrating, and so we got you out of the celebration to share your experience. So please, could you please introduce yourself a little bit and share your experience about your preparation?
First of all, thank you for this invitation, and I really hope whatever I'm going to say will benefit my colleague who's appearing for the upcoming exam.
Here for us
Uh,
to have yours. Thank
yes, definitely. My name is Mariam. I'm a clinical fellow in the Royal College of Surgeons. Currently, I'm doing my fellowship in female urology in Ireland, in Dublin. And I appeared the FRCS Part 1 in July, and I just completed the FRCS Part 2 in November under the guidance of Dr. Ankit.
you. Could you tell me, like, when did you move to UK? Or like, how many years you have been in UK, and what was your UK experience before this exam?
Okay, so I moved to Ireland. It's kind of similar to the UK program, and it was the last in July 23.
Okay.
This is my second year doing this fellowship. They're using the same system, and then they're both appearing for the same exam. Well, my story
So,
starts.
yeah.
Yeah, this for the FRCS. How did I appear it? It has really started in the beginning of even prior to prior to coming to Ireland. I was just trying to do some revision just to be prepared for this fellowship and to be more up to date as I graduated a long time ago. And I did a fellowship in pediatrics, so it deviated me totally from adults as well. It was a long gap. I did the pediatrics in 2019, and then I came back, and so that was a long time ago. And
And what motivated you for FRCS? Why did you think like FRCS is necessary for you then?
I felt like I was already prepared for the examination, and I think you know me more than anyone else. Like I had prepared my notes
Yeah.
for revision. Like I'm a person who really visual. Like I like to also I can't just keep reading and memorizing. I have to write everything I read. So I ended up maybe having 5 chapters of my own notes. So I
We'll
said, why
we'll definitely want to have a look at your notes also.
exactly?
Could you please tell me, like for section one, you appeared in July. So when did you start preparing for it? Did you start preparing 6 months ago or like a shorter time than that? When was it that you decided, okay, let me appear for section one now?
I felt well, I already had my notes prepared. So I had an idea, okay, let me join the exam by, I'd say, January. I was thinking of it. And the deadline was on April. So
Yeah.
I said, okay, if I already spoke to my mentors and everything that I want to appear for the exam, but I have to complete the paperwork and everything. Um,
So
while
what notes were there?
my notes were basically general urology,
Okay.
including everything. I was based my knowledge, my notes mainly on Donati, to be honest.
Right.
And I was like, if I have some gaps, I was adding from a book called Rafiki book. It's like MCQs. I was reading the answers before the questions, and I was adding it on top of it. It's just like I wanted to make like my own, let's say, my own
Something
Campbell.
that can be, yeah, something that can be published in future.
Okay, hopefully. So I read it. Like I said, like I will go over it again
Right.
from January until April. If I felt like, okay, I can memorize everything I wrote,
Right.
then I will appear for the exam. And that was a target for me, really. I went back to my notes. I felt like, oh, I think I know almost everything in it. Still, there were some gaps in it. And then I don't know the way they are doing the exam, to be honest, as well. So the last minute, I just brought my paper to my mentors. Like, I'm ready for the exam. Please sign it if you feel like I can attend the exam. And then he was so happy, like, to sign up my papers. So I felt like no, it's the time, so I need to do MCQs and everything. So I had to now know like do more MCQs, trying to find any question banks, especially the EBU were very helpful to be honest. And EBU was to be honest was my I said to be honest a lot, but like, EBU was the main source of my questions.
Yeah, so because the
But
pattern is almost the
easier.
same. The pattern is almost
Exactly.
the same, but it's EBU is much easier than the FRCS.
Exactly. It was much easier than the FRCS, and especially by having my colleague around me attending the clinic. I know I'm doing fellowship in female urology, but I had some gaps, like academic days, where
Right.
if not doing any researches, I used to attend general clinics. So just to see the thing that I haven't seen in a long time. Like I struggled a lot in in oncology mainly. It was like I hated oncology all my life. Like
We
it was
want
really
to know
difficult.
the challenges. We want to know the challenges you face because you had a gap. You were into a pediatric and female urology. So what
Right.
challenges you face? Because the exam test all these sections. So how was it? Like oncology you said oncology was difficult. What other parts you faced difficulty and how did you manage those things?
Okay, so oncology was my main struggle, especially because here, like in the clinic itself, like there's a lot of communication. There's a like I attended all the MDTs as much as I can that they used to discuss all the cases, and that's like mainly like I got your advice by writing a flow chart. So
Yeah.
flow chart helped me brought all the gaps that I had because my notes will explain everything, like the markers and why they're doing the markers, but it's not the exam way of knowledge or how to say it. So I had to make a flow chart, like summarize my own notes. So I had another chapter of summarizing all my notes. So that was really helpful. I also struggled in the technology part. I
Okay.
never I never felt like technology was a big thing, as I need to know, especially for the exam, especially for the FRCS part two. Part one, I read it, but it was easy to pass it because it was straightforward. It did not come as much as part two. What
Yeah.
part two I knew was a guaranteed station. If I just master this one, I know that I'm going to at least guarantee one station. And I passed it with a good mark, so I was very happy. Like I even prepared for it more than the other things that I thought I knew. So for part two, I would say it's like I established like my basics,
Yeah.
but I wanted to put all my basics together is by doing flow chart. So
Yeah.
if I have an advice to other people, just do flow charts,
Right.
really.
That's very important because everybody who is going for example, any oncology stations mainly, you should know starting from the symptoms, what should be your next. So it should be a very clear. The algorithm should be very clear. If you know the symptoms, what should be the next investigations? Then, if you get this finding in the investigation, what should be the next line of management? How do you stage the disease? How do you manage? What are the management options? Everything should be clear and try to add important points like in between if you're offering a management option, what should be the complications? To try to have everything in one single page, and that is going to give you a good material for revision before your exam. And so, so your notes, you met the first note for your section one that
Exactly.
you made in July, and then did you use the same notes for section two, or you made start making fresh notes again?
No, it's definitely the same notes. I was going to start fresh notes until you told me not to.
Yeah.
So, and then I went back to my own notes, memorizing it. And if there was anything addition, like especially the flow charts, as I mentioned, and to have the opening gambit, that's it. I just wanted to make sure that for each topic, I know what questions I need to cover, and just like keywords, just to help me what to say because I don't have time. Like I need to establish this in a minute. So it was like mostly for all the sections, I had an open gambit for almost everything. It helped me out.
Yeah, that's very important. Opening gambit is something because it prevents the silence. The first few minutes, you have an orientation how to talk to the examiner, and then depending on the questions, subsequent questions, you can frame your next answers. So opening gambit should be very clear for everyone. And what else would you like to suggest about the resources? Like you framed your section one notes from Rafiki, from your guidelines, and what else did you use for your section one notes? And when you switched to section two exam, how did you add the new notes? Like because the knowledge is to be same, it's only the practice matters in section two. But then what resources extra did you add in your section two preparation?
The extra sources, I would say, by attending the courses, I know like, okay, there's like things that I missed. It's
Yeah,
not in my notes. I need to find resources. Like first, for example, there is when you come like to preparation with other doctors. Like my partner was in the UK, so he helped me a lot of understanding. Okay, there is a gap, and he have to fill this gap. So I
yeah,
used to do like we were doing like even until the last minute, like researching and googling for the resources just to back up our knowledge. Definitely I used AIU guidelines, like some of it. I can't say like I read the whole thing, no, but I use the pocket. And if I had difficulty, I was going back to the guidelines.
right.
It's a lot, to be honest, to read, but sometimes like like there are things that you need to go back. You can't say like, oh no, you don't need to read. No.
So everybody should remember, like, if you are thinking that your notes are sufficient, you will never get a very satisfactory feeling till the end of your preparation. You will always feel that your notes are probably missing out something, and you might have a temptation of going back to the guidelines every time. But then make sure you are not spending too much time in reading the new things. You are adding up new things, but then you are revising at the same time whatever your content of the notes is. I think that should be the message, that you go back to the guidelines, look for new things and come back, but make sure don't make new notes every time. Keep on leaving space there so that new notes can be added to the same content. So how many pages your notes are? Because my
Uh,
doctor is very famous for her notes. We have been talking since last 6 months, and I think she has been making notes, and we have been talking a lot about her notes. So how many books you have written till now?
I have four books, four
Oh,
chapters, and one MCQ and one Viva,
okay, they're all written by you.
all written by me.
Okay, and from that compiles all the resources that anybody can get access to for FRCS preparation. Is there
Exactly.
any
Like
other sources that we haven't discussed yet? Any other resources that we haven't discussed yet?
yes, especially the Bauhaus leaflet. Bauhaus leaflet was a must for the exam.
Yes.
And for example, I got this, to be honest, this advice was from my mentor. When I used to consult the patient, I used just to write the general in the beginning. And then she told me, oh, you're attending the FRCS. If you're attending the FRCS, you have to really read it and write the percentage so you can memorize it.
Yes.
So that was really the best advice I had. So I was reading, and so for example, like I'm doing Botox, which is very simple. Everyone, like we're doing it almost like every week in the list.
Yes. Yes.
When I was just telling the patient, okay, you might have like retention, especially like infection, all the like post-op like expected complication.
Yeah.
The patient can ask me like what the percentage that I would be like in retention, and like I'm doing the fellowship, so I really need to back up my answers with percentages.
Absolutely.
And
Absolutely.
neurogenic is different than non-neurogenic, so it really helps also in practice. It backed me up as a fellow as well.
Right.
So I did not, for example, I did not know also that okay, there's a weakness in the arms and legs. So this is like by reading more, it will give you even more explanation. Like if that very rare thing happened to the patient, it's your own responsibility that you have to mention it in the consent.
How many times did you revise the notes?
My notes, four times.
So
Four
for
times.
and for the section one and section two separate.
Section one, I revised them two times, and section two, I would say like one and a half, because the first time I revised it all, the second time I was just like picking what I want. It's
Okay.
just like in total four times. But to be honest, the whole preparation, I'd say like I decided on April, and I did this on July. So people would say 3 4 months. I would say 6 months for like a slow learner like me who
The
likes to write
fellowship is
everything.
always busy, so don't get so much time to prepare. How much time do you get per day to prepare, like to study?
Minimum, I have to put 3 hours minimum.
2 to 3 hours per day?
3 hours per day. But if there are days that for example, I'm not able to take this. Like I have busy days. Sometimes like I'm on call. Sometimes I have like I'm too tired to do. And like I'm a mother with kids. They
Yeah.
don't allow me to study
I
some
know
days.
your kids have attended the classes along with you. They must have learned half of the urology by now. So
Exactly.
how did you manage this whole thing, your duty, your fellowship, your family, and then your study? Like this is something which is very important because many candidates who are appearing have a family, have a fellowship running are in a training post. So they want to know, like, is it very difficult or impossible to do all this? Because you've made it possible. Definitely, it's possible for them. So you should send a message to them and you should be a motivation for them. How would you like to send a message to them?
I would say if you have a target in your mind, it's like nothing is impossible. It just you have to have I would say a timetable, and always by like being a busy mom, I would say prepare ahead, like like ahead of your schedule.
Right.
Today, if I have an extra hour, I'll just like do whatever is going to be happen. For example, tomorrow, so I have to be ready for unexpected things to happen.
Right.
Having meal preps by mom, having a supportive husband,
Right.
that was really important, especially the last 2 to 3 months. And if there was any really advice until the last minute of the FRCS Part 2 exam, is stay away from your friend the last week.
Right. And very
Exactly.
important thing that you said, I think I must emphasize that again, prepare your tomorrow today only. So you
Exactly.
plan your tomorrow today only. Don't sleep without planning what you are going to do tomorrow. So if
Yeah.
you don't
I
have a
struggled a lot.
plan tomorrow,
I
you
kept
are going
telling me
to
what to have tomorrow.
you're going to wake up without a plan, and that's going to be you're going to waste half of your day thinking what should you study that day. So, if possible, plan your week on the previous week itself. And but if you can just start with a small step by planning your tomorrow today. That's a very important thing that you highlighted. I think we have discussed that before in the classrooms also, because this is very important. Unless and until you plan your next day target, you don't set a target for the week or for the next day, it will be difficult for you to wake up with a plan and just meet those targets on time. What was your last month plan? Like, did you make a schedule? How was your strategy for the last month?
The last month was really stressful, to be honest. The last month, as soon as I get back from work, I did not take leave on the last month. I
Yeah,
was working.
yeah,
And so as soon as I get home, I was attending your class if there was a class. Otherwise, I would do my own revision. And I have a schedule at 8 o'clock. I meet with my friends online until 10. And then if someone wants to sleep, we'll continue. Whoever is awake, we'll continue to 11, even 12. And then we'll repeat the schedule for the whole month, to be honest. That was very tough month.
yeah. That's another message that everybody should take this from Dr. Mariam, that you don't need to take leave from your work to pass this exam. Like people take leave for 15 days, take study leave, and this not required because she did not take leave. She took the leave. We were discussing again this before also. She took leave only for the travel for the exam center a few days before her exam. So that's a very great message that everybody should take from her. How did you prepare for the exam days yourself for the like section two?
Okay, so for the section two, as I mentioned, we used to do the studies, the like Zoom meeting, and we used to make up scenarios, hypothetical scenarios, and we used to go along the whole scenario until the end. Sometimes we do timing, but
Yeah.
in the beginning of the month, we were not timing each other. We were just trying to cover as much as we can. But at the end, no, we were starting to do like the timer, and then each one was giving the feedback for the other, and everyone was like we're saying, oh, you're scattered, you're not organized, you have to organize yourself. Like I was getting all the feedback, so I felt like okay, the last couple of weeks, like I used to even not attend those private classes that we used to do together, me and my friends. So I used to take a video of myself. I put it like the camera in front of me. I was talking about like talking to myself, videotaping, seeing the way I talk, my reactions, and that's I felt like okay, I'm missing this gap. I'm missing this, like I need to speed up, for example, because it's like when I see myself in the video, like I just get frozen, like I don't know what to say. So I was
Right.
like, I don't want the examiner to feel the same, so I need to keep practicing by talking it and make
Very
it more fluent. So
very
I felt like it
important.
helped me.
Yeah, yeah. You should be very receptive of the feedbacks. Like you will get feedbacks if you talk to your friends, the study group. If you appear for the mock exam, they're going to give you certain feedbacks, and be very positive for all the negative feedbacks that you receive. Everybody should be going for the mocks, going for the practices, and if you receive negative feedbacks, try to get learn from them rather than getting disappointed and thinking that okay, no, this is not possible. Because as Mariam said, people will tell that you are scattered and you are not very organized, but then it's you can make it possible. You can just organize it, think what is going wrong with your viva, and try to just assemble it together and present it. It's possible. Everybody can do it. So, what's your message for because the next exam is in January, section one, and it's in May, section two. what's your message for them? Because many of them are going to appear for these upcoming exams. They have 1 month for section one and 4 5 months for section two.
Regarding section one, try to do as much MCQs as possible. And I would say take the last week, like by not the last week, the last day, just have a full sleep and don't think about it. It's going to be easy. The exam is really, it's like it's based on your general knowledge more than anything else. Not much of a guidelines in the first in the part one compared to part two. That's what I think. And like if you came across any study that's just like don't put it in the middle of your notes. Take a separate sheet, just write all the studies together. So it will help you for the last part of the exam, I would say, just to go over the studies, because you will forget, and then don't flip all your notes to find that studies. Like
Right.
just put like on this like BBH, okay, there's mTORs, there's a combat. Like you just have to just put them in a separate sheet. So
You
it will
would
be
want
easy.
to know more about this, Dr. Mariam, since you have made a lot of notes. We want to hear from you as well, suggestions for notes making. Like what should they do? Because I think you have made your section one notes and continue for section two. Even I recommend that's the best thing that you do. Your section one notes, section two notes should be more than 90% ready when you are appearing for your section one exam. And that is what you did, I think. So what are the strategy, what other technique would you advise for note making? This is very nice thing that you said. Write down the studies separately and attach it, and you bookmarks for the notes. What else would you recommend?
I would recommend if they want to study, they have to study the way the exam is. For example,
Right.
oncology is oncology. Try to put like the infection with the stones, the female with the bone dysfunction, the gynecology altogether, BPH.
Yeah,
It's
grouping
exactly
the
like trying
sections
to
together, right? The
exactly
sections should be grouped together because that's how the section two is conducted. Till now, there is
exactly.
change over many years. This grouping is remaining same. So it's better that you make your notes in that way and you train your brain to answer the questions in that way only. How many courses did you attend, and how many marks did you give?
So I would say the best course that I attended is your course, to be honest, for both part one and part two. Very up to date. It helped me to add a lot on my notes. I even at the end of like I was looking, where did I get this new information? I've been asked in the exam about technique, which is like I've never heard it, and I did not find it somewhere else. I only found it in your course. So I was very confident answering this question, and I got a mark. I think not all the people would know the answer if they did not attend your course,
Yeah.
and you explained it really well, to be honest. So that was one of the points. Like if it was your course was a backup for my knowledge, for example, and also your guidance, the opening gambit. You give us special mnemonics to remember, and as I told you in the beginning, I'm a visual person. So the more you talk, the more the information will stick in my mind. So it was very helpful. I used to give like my time just for your course. So like I will leave everything, just like I need to attend this course, even if I did not do well during the course or during the mock exams, but I knew at the end I have the basics just to keep going.
Yeah.
Part one, part two, you're very up to date, and it's exactly how the exam comes. So even if it's hypothetical scenarios, it's exactly how it comes. Even like one of my colleague got, which is like not a very common scenario, and when he got it, I've like he was very sad, and I felt like I knew it from your course. Otherwise, I wouldn't know that it might come up.
I think the ones that you said, the mnemonics. I think I encourage mnemonics because when we sit in front of examiners, we have a tendency of getting nervous, and tend to forget a lot of things. Even we are prepared, we might have prepared a lot, but then at that moment, we have a tendency to jumble up things and to lose our orientation for a while, and then the confidence starts dropping, and we start messing up further. So the mnemonic gives us a direction, gives us an idea to remember the buzzwords, the keywords, because that's all that we need to remember to frame a sentence out of it. So I think that's why we had a lot of mnemonics for everything, so that when you hear something that flashes in front of your eyes and you can just articulate a sentence of what's your message for the students, like if they have to go for the section two and they have 4 to 5 months left, what they should do from now.
Okay, for section two, as soon as you finish section one, don't take the month break like I think everyone did.
Very important. Yeah.
Don't take that month. Keep going.
Right.
I know like you worked very hard. The FRCS part one is really like as soon as you get the result, you're happy, and then it's like, oh yeah, you're
Yeah.
gonna just postpone and then postpone and then postpone, and
Yeah.
it's really it's the worst decision you'll ever take.
Yeah. Yeah.
Because
Don't let the
every
break the flow.
exactly, especially that the first month when you're like I would say like when you're lazy in studying because you know your knowledge, write your or just like make a plan at least
Yes.
uh, know how the exam works. It was for
Yeah.
me, it took me a month to understand, okay, so how does the exam going to be? I know like they say like okay, 20 minutes, 20 minutes, but when you're in the exam, it's different. The stress takes over. So you
Right.
really need to finish or know how the second exam works and don't wait for the boss to tell you how the exam works. At
Right.
least have your opening gambit and have your flowchart ready when it comes to the exam itself. Okay, you just keep practicing.
So, Dr.
And
Ma'am, what else you want to suggest for the candidates? Like, because everybody seems stressed for the preparation, and we get a lot of queries from them. What's your opinion for them?
the best advice I got from you, that's I would say like I can conclude my whole meeting with you with this advice. Before the exam, don't study section by section. Do it randomly. You told me take an hour, like if on call you take an hour of BPH, take an hour.
Yeah,
Like for me, I cannot take an hour. I was taking 2 hours, 2 hours, 2 hours. I take time to revise. But that was the best advice you gave me because it made me think when I went to the exam that oh, okay, I went through everything.
yeah, yeah. I want to emphasize that again. What we are discussing basically is a problem because one of the candidates said that he's studying oncology. He's planning to study oncology for 3 to 4 days. Then he's planning to take up pediatrics for 3 to 4 days. This was his last month revision plan. He said he discussed with me, and then by the time he's doing his exam, he's just finishing the andrology or BPS something. So he's planning 3 4 days for every topic. But I said this is absolutely not required. This kind of preparation is going to make you feel at the end of your preparation you are going to just feel the first topic that you studied. Probably you're going to forget those topics. You will start losing confidence in those topics. So your last month plan should be, or last 2 to 3 weeks, what you prepare should be you're spending few like a couple of hours for your oncology, 1 hour for pediatrics, 1 hour for andrology, and so on. Try to keep most of the topics in a day.
Dr. Ankit, I really appreciate all your advices. Really, like it's for a person who was scattered for preparing myself. All the advices that you told me, you used to tell me earlier, but I find out as well, like as I'm going, I found okay, yes, you told me this. I have to do it, and I have to like I can't do the whole advices in one go, and I can't appreciate it from the beginning. But I kept your advices like in my mind, and I applied it till the last minute, and nothing you said did not come. So
Thank
really, I you were the best mentor I ever had.
thank you
I
so
really the best, really.
Thanks a lot for your kind words. And I really, because my main motive is to make it easy for everyone. Because I know there are a lot of lectures available, a lot of courses. I have due respect for everything, but my main motto is to make it easy as much as possible. The whole course is about my notes, about my experience, and about the problem that I faced and the solutions that I put into it. Because I've tried to compile all the guidelines together. You won't have problem like you don't have to search for them. You don't have to go through the EAU for yourself. You don't have to go through the NCC, and you don't have to go for the Oxford. It's all together for a particular topic. Nice guidelines for that topic. So you don't have to rush after different things. That's my whole motto because that is the problem that I faced. I think that's why people like this. And I'm sure that whoever attends the course is going to benefit just because of this purpose. The whole things becomes easy for them. And then, but the success only depends on your hard work. I'm here to make it easy for you, but then it's your hard work, your persistence, your perseverance that made you pass this exam. And a big congratulations to you. I think, what are you going to do with your notes? Are you going to hand it to your kids? Are you going to frame it for your kids? What's your plan for the notes?
Well, this the scratch notes, I gave it to them to scratch on them. That
Oh,
was like a big relief for me. But the other note, I just like I kept them on once, and I think I'm gonna use them for the coming years until they get like new updates. I would say one thing like we forgot to mention. When I was doing my note, I used to draw a lot.
yeah.
So the drawing come up in the FRCS part two. So
Yeah,
don't ignore the
we
drawing.
we would like to emphasize more on that. Could you tell more about that, the diagram part? Because we have taken a lot of interviews, we never emphasize on the picture-based questions. So
Exactly.
the pictures that you need to draw, because the examiners give you a pencil and a paper to draw something. Like, did you face
You
any?
don't expect really what to draw. Like some people, like if you ask previously people who attended the exam, okay, you might expect to draw this thing. You might like you know like definitely you might be expected to ask and today like they will ask you how to draw the prostate zones, for example.
Yeah,
But like until the last minute, they told me, oh, sometimes it came up in the exam how to draw the chronic retention chart. It's like I don't know how to explain it. Not just like drawing. So you need to learn how to draw and explain at the same time. Some of the guaranteed like scenarios would be like ESWL or like the way how the machine works. There are very famous, like if you come across all the revision, you would know like what to expect, but there are things that you don't know, like like what's gonna come up. So everything you feel like it might come, like all the equations, the urease producing enzyme, bacteria. So this definitely you need to know the equations. So just while you're doing your notes, if you're doing like the same
right.
if
Definitely.
you're, yeah, you have to have like a separate papers. Like until the last minute I had a couple of notes.
Always when you are making notes, try to keep some diagrams beside it, because that's might be asked, might not be asked, doesn't matter. That's going to make your concept more clear. And every because the diagram speaks more than 1,000 words. So when you draw, you also learn a lot about that. You get a more clarity about that topic itself.
Especially technology. Like I could not explain it. Like I knew all the buzzwords, but
Yeah.
I could not put them all together in that minute. So I even told the examiner, "Can I have a paper? I know there's a paper. Can I have a paper? I'm just gonna draw it to you." And I started drawing for the examiner, and then the other one was like looking at me like this. Okay, so he was really into it. So they were really understanding the way I was drawing it really bad because I mean they're really good. So they knew I know what I'm saying, and
Right.
then I got used to the way I was drawing it, so it was easy for me to do it very quickly. And
Yeah.
then they were very surprised like the way I explained it. Like the picture does not look like the picture in the books,
Yeah.
but it was very clear for them to understand what I'm going to say.
So yeah, you should be able to make it understand to the examiner. So if required, you might use a pencil and a paper and a diagram. So that doesn't that makes it better only. That doesn't decrease your mark. That's only gives a good impression that you know that you have more clarity on the subject. So, Dr. Mariam, do you have any other message that you want to convey to them? Because you did it really because you had a lot of struggles, you have a lot of challenges you faced. You did not have much time also because you did not take a break also between your two sections. You were doing a training post that was also busy. You did not take break for your exam. You have kids with you. So, what message do you want to send? The last message you want to give to the to all the candidates who are going to appear for the next exams?
I would say just keep the goal in your mind. Um, Always be positive and just believe in your work. Like don't listen to everyone who's going to put you down. Like I came from a different country who never, for example, like they did not set the exam before, and I just believed in myself that I can do it. I can, like I just want to be proud of myself, of my hard work. I'm not, I want like I wasn't expecting someone like to clap for me or like yes you did it. Like it's from at the end it's for my own benefit. It might not even add anything to me. It's just like for myself.
Right. So do it for yourself.
And like like I'm going to practice back in my country. Like it's
Right.
not, I'm not like staying in the UK. So my target was different than other people's target. Like I just in the beginning it was just a revision for myself, and then I can do it. And then
Yeah.
if I do it, it's gonna be very good for my CV.
Yeah.
And if I have an opportunity to come back if I want, like I can do it. So it just opens more opportunity.
Right.
So just have a goal in your mind and then don't listen to other people. Okay, you're from different country, your system is different, you're in Ireland, you're not even in the UK. No, everyone can do it. So I would say like if I did it, everyone can do it.
Right. So don't let anybody spoil your confidence. Your confidence depends on your preparation, your knowledge, and your self-belief is most important for success. Nobody can make you pass, nobody can make you fail, nobody can decide your career, your future. It only depends on you or yourself. Your hard work will decide it. Thank you so much, Mariam, for your time. And
No worries.
Wish you all the best for your upcoming job, upcoming all the endeavors that you take in your life, and see you soon. Stay connected because we are going to take more opinions from you. And if there is any of them, drop me any email regarding any questions. We are going to communicate straight to you, and
Hopefully,
you will be answering them for their any doubts.
we'll
Okay.
do that. Yes, thank you so much for your time as well.
Thank you so much. Thank you,
Good luck for all the other people who's attending the exam as well.
everyone, and see you soon. See you, everyone. Yeah.
Thank you.